Good afternoon, everyone. As you said, my name is Teresa White, and I'm very honored to be here as part of the CEDARS and NCPAD Disability Health Symposium today. And I'm able to share my story with you regarding my journey with multiple sclerosis. As this slide shows, I want to tell you a little bit about what is MS. I am not a medical professional, and this will give you a little bit better definition of what multiple sclerosis actually is. In summary, multiple sclerosis, or MS, is an autoimmune disease that affects the central nervous system, where the immune system mistakenly attacks the protective covering of nerve fibers called myelin. This damage disrupts communication between the brain and the rest of the body, leading to various symptoms such as muscle weakness, vision problems, and numbness. In simplified terms, the messages sent from the brain of a person with MS are no longer to always reach their destination within the body, and that in order to complete the request on how to move or react to that brain signal. An analogy explained to me that's a little bit easier to understand, and it may help you better visualize it, is to imagine an electrical cord from a lamp. Now that cord is frayed, exposing the wires within. When that lamp is plugged into the wall, the current still travels from the cord, from the wall, up to the bulb, and then along the way, it misfires where there's no coating over that wire. So eventually, the signal does reach the light bulb and it comes on, but it probably flickers or goes out, comes back on, goes out, doesn't stay consistent and do what you expect it to do when you flip that switch. Having MS is like that within your own body. Your brain may tell you what you want your body to be doing, and your body says, maybe not today. For people with MS, this disrupted communication becomes a daily occurrence, and it affects everyone differently. There are 4 main types of multiple sclerosis: relapsing remitting, secondary progressive, primary progressive, and clinically isolated syndrome. Relapsing remitting is the most common, affecting about 85% of those that have been diagnosed. In my case, I am what I would call the very mild end of relapsing remitting symptom chart, bothered only by tingling in my feet, which is easily averted with arch supports, and then I do have occasional fatigue. For the ease of speaking for the rest of my presentation, I'm going to refer to multiple sclerosis simply as MS. Especially, MS and I become friends, so I feel that I can use a shorter name. Confused, unsure, scared, worried, all the feelings hit me at once with questions as this slide shows. Literally overnight, I went from having no worries about my personal health to a state of confusion and extreme worry. My journey with MS began the morning before my 30th birthday in 1998, so you can do the math, and when I woke up with a tingling feeling in my right foot and my calf, similar to the sensation you might have if your hand or your foot falls asleep after being in an odd position for too long. While it was annoying, I figured I had just maybe pinched a nerve somehow and that it would go away on its own. The next morning, however, I woke up with the same sensation in my right leg, but now it was up to my knee and also in my left leg. Off to the doctor I went. My doctor ordered some tests and then sent me to a neurologist to run some scans and said he would reconvene with the test results came back to discuss what they'd shown. At this point, the thought was likely a pinched nerve, since I had delivered twins 4 months earlier and had had an adverse reaction to the epidural I was given prior to their birth. The neurologist had me admitted for an overnight stay in the hospital, and just in case you wondered, they do not offer birthday cake on a hospital menu, so I missed out. They did plenty of blood work, a CT scan, a spinal tap, which I definitely do not recommend for any reason. Several hours later, the doctor came back to my room and said, "You have MS, so I'll let your doctor know and start you on medications," and he walked out. This doctor's extremely poor bedside manner, and if I'm being honest, pretty crappy personality, where my first experience was subpar medical assistance. But thankfully, I had an amazing primary care doctor. I was sent home with steroids via an IV to help with the initial inflammation that was determined to be the cause of the tingling sensation, and told to call my doctor 2 weeks later for a follow-up. I called my regular doctor from the hospital and was in his office 2 days after being released from the hospital, not 2 weeks. This medical professional looked at my results, reviewed and discussed them in detail with me, asking me questions about my overall health, any possible other symptoms, and in short, showed me what a positive experience with a medical professional should be. From this point on, I began my journey to learn not only about what my possible diagnosis meant, but what I should expect and demand from my medical team. The importance of clear communication and being seen and heard every step of the way. During my discussions with my primary care doctor, we talked about the epidural I had received 4 months prior when my twins were born, and that when it was administered, I literally, though completely unintentionally, kicked a nurse into the wall when they put the needle into my back. They had obviously struck a nerve, and literally. Arguably not one of my best moments, but she was a wonderful person, and I apologize profusely forever. My primary care doctor then told me about a classmate that he had had in medical school. She was pregnant during school, but showed up at their graduation in a wheelchair after giving birth due to an adverse reaction to the epidural she had received. While she later regained mobility, it was determined that the injection had caused extreme swelling in her spinal cord, which affected her legs. Due to the similarities in our situations, my age, overall good health, and lack of any other symptoms, we agreed to wait and see if any more symptoms developed that could support the neurologist's original diagnosis. I continued to be monitored regularly and did not experience any symptoms, similar or new, that would lead me or my primary care doctor to believe it was anything beyond a one-time reactionary inflammation issue. Flash forward 11 years. I still had not experienced any other symptoms, similar or new, and honestly had really just put it out of my mind. By this point, our family had moved to Alabama for my husband's job, and our 5 children were now ages 11 to 16. So life was busy and active, and I was feeling fine, or so I thought. I was working part-time for some friends who owned a restaurant, so I was spending a lot of time on my feet on cement floors, and I developed lower back pain. I started with self-treatment of cushioned shoe inserts, which helped to begin with, but not for long. Went to the doctor, who ordered physical therapy for my back pain. I was taught exercises to help with stretching, improve my posture, and try to relieve the pain in my lower back. This worked for a while, but then I started to have heel pain. The doctor found a heel spur, which is basically an extra piece of bone that forms across a joint, usually in a joint, as a way for the body to try and fix something that it thinks is damaged. The fix for that was simple: arch supports in my shoes to relieve that pressure on my heel, and again, this also worked for a while, until it didn't. Thankfully, I once again had connected with the right primary care doctor, who was not giving up on trying to figure out my symptoms, and as soon as he suggested that I visit a neurologist, my previous experience all came flooding back like a bad dream. While I had told him about my prior experience, the fact that it had been 11 years without any symptoms gave us both some hope that the reason behind my discomfort was something completely different. Let me rephrase that. He had hope it was something different. But for me, the other options were even more frightening. Was it cancer? Was it a tumor of some sort? Had I developed a spinal condition? What was this mystery cause of all my discomfort? Off to the neurologist I went, and this time it was for a week-long stay in the hospital for more tests, IV steroids to help with the inflammation. Unfortunately, another spinal tap, more blood work, and plenty of scans, and then we played the waiting game until the results came back, as I caught up on my reading in a quiet hospital room Remember, I had 5 kids at home. Absolutely no symptoms being felt at this time, no discomfort. Due to 1, I was not on my feet, and 2, I had plenty of steroids in my system. In the back of my mind, I knew it was likely going to be an MS diagnosis, and as odd as it sounds, with all the other worst-case scenarios running through my head that I mentioned a moment ago, I was at peace with that. I was discharged from the hospital without a formal diagnosis, and I had a pretty good feeling that that was where I was headed. Then everything changed for me in a different way. The morning I was to be released, a tragic shooting occurred at the local university where I live, and the victims of the shooting were being rushed to the neuro ward as I was being discharged. Later that evening, we found out that a family friend from our church was one of the victims, and he was fighting for his life. From that moment on, my attitude changed for the better. When friends asked how I was doing after hearing I had been in the hospital, my answer was, I'm good. Because if I was being faced with a diagnosis of a chronic condition, as others were fighting for their lives due to a situation completely out of their control, I knew that taking ownership of my condition, and especially my attitude towards my condition, was the only way I could face it and make a difference in my future. I'll come back to my attitude in just a minute. As I mentioned, I've been blessed to find a dedicated and caring primary care doctor who was fully on my side, and as soon as my diagnosis of MS was confirmed by a much more pleasant neurologist this time, a new care plan for my long-term health was put into motion, with me acting as a vital participant. Since the local neurologist didn't specialize in MS care and treatment, he and my primary care doctor agreed I had one of 3 options. I could seek care at UAB, I could seek care at Vanderbilt University, or I could start with a doctor in Coleman, Alabama. Now, for those of you not from this area, Coleman is a very small town and probably the last place that comes to mind when being compared to larger facilities and university health study programs like UAB or Vanderbilt. But as fate would have it, an extremely knowledgeable and caring specialist had set up his practice in Coleman, and that was where I chose to begin my next chapter. As this slide shows, I quickly learned the importance of a patient-centered healthcare approach and learned to ask the questions I didn't even realize I had. From the beginning, my new care team walked with me through the ins and outs of my new health reality, and I quickly learned that no question was not worth asking, as I was expected to be an active participant in my future 100% of the time. While the first reaction to receiving news of a chronic and currently incurable, though highly treatable and manageable condition like MS usually isn't gratitude, for me it was. When it was confirmed that I had MS, I was grateful that I finally had answers to what was behind my weird nerve sensations, fatigue, and other symptoms. I'm blessed to say that 2 weeks ago marked 15 years since my confirmed diagnosis, and next week, I will see that specialist in the little town of Coleman, Alabama, for my annual checkup. I have no reason not to expect that once again he will say, there has been no progression of your MS. My faith and my family are an incredible source of support and strength for me as we have all learned to navigate how MS would potentially change my abilities based on what my body was telling me that day. I've learned to listen to my body, taking time to actually pay attention to what it is telling me. And as hard as it is for me to personally put myself first, I have learned that the benefits are immeasurable when I do. I've connected with local and national resources, such as the National Multiple Sclerosis Society, UAB, NICPAD, and my MS team, to name a few. I've been an active participant in events to bring attention to the continued funding of research for a cure, such as the annual MS Walk, and I continue to embrace a life living with MS as I do my part to help find the cure. I firmly believe attitude is everything, so I encourage each of you to choose a good one because it will shape your outlook in ways you never imagined. Now, I had to make an addition here because Dante stole one of my slide focus, but it was already on there when I turned it in. A friend of mine in one of my research studies, so we may have to compare notes, we may know the same people, said this best: we are a group with varying and different abilities. By embracing them for what they are and how they make up a part of who we are becomes our superpower. So, as I enter year 15 of living in life with MS as my superpower, I will continue to embrace the power I have to be my own advocate when it comes to my health care, as well as the power I have to be an advocate for others by participating in events, studies, and presentations that allow me to share what MS looks like on a very real level. Multiple sclerosis is sometimes called a hidden condition, since not all symptoms are visible to others in every case. There are days when I say that I'm fine, but I feel like a hamster is running a marathon in a wheel inside my head. There are days when I say I'm feeling good, but I actually have a lot of pain. And there are days when I say it's really nothing, but sometimes it is a lot. And on those days, I step back and I remember that my health is in my hands and that the attitude I put towards it makes all the difference. Each one of us has a superpower to put to use to make the world a better place, simply because we are in it. I encourage you to embrace your superpower, use your voice, and share it with everyone you meet. Thank you for allowing me to share my story with you today.